Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm joined by Dr. Christian DePaula, and today our topic is sciatica. So my first question for you, doctor, is what is sciatica?
Well, sciatica is more of a description than a diagnosis. It's sort of a broad category. I like to think of sciatica as sort of either a broad net or sort of the top of a funnel. So oftentimes the way of people often describe a distribution of pain, and it doesn't necessarily tell us what the true problem is, but more so where I'm feeling pain. And oftentimes people say I have sciatica, they're referring to pain in their buttock or their hip or running down their leg. And the reason we use the term sciatica is because it refers to the distribution of the sciatic nerve, which gives a sensation through the buttock and back of the leg into the foot.
What causes sciatica, and does it affect people of a certain age?
You can pretty much get sciatica at any age, and because it's sort of this broad distribution of diagnoses that can be included in the term sciatica, what's important is for people to kind of cone down on what the actual diagnosis is. So when people come to me, I often try and hone in on what they mean by sciatica, because different people have different ideas of what it really is. And some people have a more sort of classic understanding of it being pain all the way to the foot, whereas other folks say, hey, I have sciatica, but they're really pointing to buttock pain or hip pain. There are a lot of different causes, and not all of them are from the back itself.
What are the symptoms of sciatica?
When people say I have sciatica, they're referring to having pain. But sometimes that could be also sort of electric shock symptoms, sometimes a sort of numbness or tingling. And sciatica represents a distribution also. So again, the buttock, the back of the leg, down all the way towards the foot.
How is sciatica diagnosed?
Through a good history, a physical exam, seeing your doctor and going through all the appropriate, addressing the appropriate causes first. So you first have to suspect what are the causes before you can find them. And some of the things can be diagnosed through just a history. Other things require a good physical exam. And then sometimes you need imaging as well. For instance, if someone says they have sciatica but actually have hip tendonitis, then typically that can be diagnosed by a physical exam and history. But oftentimes we will do imaging as well to rule out other very common causes like a disc herniation, spinal stenosis, bone spurs, that sort of thing.
What is the treatment for sciatica?
Again, it depends on the cause. So first and foremost, you have to get a diagnosis. And if what you're referring to as sciatica is a tendonitis instead, then your treatment's going to be a lot different. For instance, maybe physical therapy or anti-inflammatories versus if your sciatica is caused by a disc herniation, which again could be physical therapy, but also could be elevated to a cortisone injection or even surgery. Sciatica is a good topic because we use these general terms, and oftentimes people think of the term sciatica and reference their back, and the two kind of develop a mental picture of this must be a back problem. And oftentimes we need to take a step back from that and stop and think, well, what are the other things that could be causing this pain in this distribution that's often associated with a back problem, a disc herniation, or a pinched nerve, when in reality it might be a number of other things such as muscles, ligaments, tendons, or irritation of the sciatic nerve itself, which originates in the leg. So the nerves, they make up a bundle that multiple nerves sort of coalesce from the lumbar spine into one big nerve, the sciatic nerve. And so you kind of have to think of any of the steps along that path that could be causing those symptoms.